Hi, this is Dr. Pandey. Welcomes you all to the Health Awareness video program. In our previous video program, we have seen the hyperthyroidism categories. In our today's program, let's have a glimpse of hyperthyroidism clinical features and symptoms. Where the word hyperthyroidism means increased thyroid hormone level or increased T3 and T4. Now the word hyper means high and the word hypo means low. Now before further proceeding for clinical features of hyperthyroidism, let's have a quick review of thyroid hormone formation, where the hypothalamus secretes thyrotropin hormone and anterior pituitary secretes thyroid stimulating hormone, where the thyroid gland secretes T3 and T4, which we call as thyroid hormone. T3 means triiodothyronine and T4 means tetraiodothyronine or thyroxine. Now let's have a glimpse of hyperthyroidism clinical features, where the increased thyroid hormone level will affect on brain by increasing the sympathetic nervous system activity. When the sympathetic nervous system activity of the brain has increased, that may lead to an anxiety as well as sleeping disorder, insomnia and irritability and lid lack as well as lid retraction. These are the few symptoms of increased sympathetic nervous system activity in hyperthyroidism. Now, apart from this, there is a possibility of goiter in hyperthyroidism due to hypertrophy or increased iodine levels. These are also the possibilities of goiter in hyperthyroidism. Now let's see how exactly the hyperthyroidism affects on the body cells, where it increases the metabolic activity of the cell, where it increases glycolysis, it increases lipolysis and it increases glycogenolysis, where as we know that the glycolysis is a conversion of glucose into pyruvic acid, during which with the free energy which is formed will be used for ATP formation, and lipolysis is a breakdown of glycerol and free fatty acids, as well as the glucogenolysis is breakdown of glucogen into glucose 1-phosphate and glucose. During this process, where because of this the heat will increase, that will lead to increased body temperatures and the weight loss. That's the reason why in hyperthyroidism we see that the patients complaining of weight loss. Now in cardiac output, hyperthyroidism will increase the ADR-B1 activity. The ADR-B1 is beta-1 adrenergic receptor, where it increases the contractility of the cardiac muscle. Because of the increased contractility, the stroke volume will increase. When the stroke volume is increased, then the blood pressure will increase. When the blood pressure is increased, then it increases the heart rate. So there is a possibility of increased blood pressure, which we call as hypertension, and increased heart rate, which we call as tachycardia. That's the reason why in hyperthyroidism patient complains of hypertension and tachycardia. In bones and muscles hyperthyroidism, the normal thyroid hormone level, the normal thyroid hormone is to maintain the balance between osteoblast and osteoclast. But whereas in hyperthyroidism, it promotes the increased osteoclast activity. Because the osteoclast activity has increased, then there is a possibility of calcium reabsorption. When the calcium has been reabsorbed from the bone, then there is a possibility of osteoporosis. When there is a osteoporosis, then there is a possibility of fracture increases. That's the reason in hyperthyroidism, whereas in adults or in elderly, they complain of frequent fractures. And on muscles, because in hyperthyroidism will increase the muscle weakness and pain with tremors. Now, in gastrointestinal tract, the increased thyroid hormone level will increase the motility and it will increase the secretion. When the motility and secretion increases, that may lead to diarrhea and dehydration. In hyperthyroidism, patients frequently complain of diarrhea and dehydration due to the increased motility and secretions of GI tract. Now, in hyperthyroidism, liver increases the secretion of thyroxine binding globulin, and it also increases sex hormone binding globulin, and it increases LDL receptors. Now, due to the increased LDL receptors, we will see the low LDL levels in blood circulation. Now, on skin, where the increased thyroid hormone levels will increase the blood flow to the subcutaneous veins and increases the secretion of sweat glands, due to which there is a possibility of hair growth, oily skin, nail growth, and increased sweating. In hyperthyroidism, we see that the patient often complains of increased sweating. Now, that increased thyroid hormone levels or hyperthyroidism will affect on reproductive system too by increased sex hormone binding globulin, where in female it reduces the estrogen circulation in the blood, whereas in male it reduces the testosterone circulation in blood. Because the reduced estrogen levels will possibility of increasing infertility and irregular menstrual periods, which can lead to oligomenorrhea or amenorrhea. And reduced testosterone levels in the blood will lead to low sperm count. So these are the few clinical features and symptoms of hyperthyroidism. with some more information related to hyperthyroidism. We will meet in our next video. Thank you.